Good Wednesday morning. I'm Deborah,
And I'm Rachel.
and today we have a special guest, Raffy. You
ma'am.
are with Synergy Therapy
Physical therapy.
Physical Therapy Group.
Yes,
So you're actually the owner.
ma'am.
Awesome. How long have you been in business?
The staffing, I think it's been a while for like 5 years, 6 years. But we opened our outpatient clinic 2 years ago.
Okay, so you do in home, and also they come to you to do therapy.
Yes, ma'am. So I have contracts with home health agencies. So you know how it works from inpatient therapy to how home reintegration, they do home health. And then once they're comfortable and safe at home, we will do community reintegration where they can go for outpatient physical therapy to achieve those goals for community reintegration.
So let me ask you a question, because a lot of people, when you're talking to them about home health, they get a little confused. So there's in-home and then there's outpatient
Yes, ma'am.
therapy. Which one do you recommend the most? Would you start with, especially coming out of the hospital?
Yes, because normally how it works is like this: when the patient, something happens, surgery, patient falls, they go to the hospital, surgery, and then they would do rehab there because they cannot go home. Especially most of our adult population, they live by themselves,
Correct.
so they're not safe to go home yet. So they undergo inpatient rehab, couple of weeks when they're ready, but most of the time they're not ready to go home. They need somebody to take care of them. They go to a nursing home for therapy.
Which is called a sniff.
Yes, the skilled nursing facility. They do therapy there, and then after some time, when they're ready to go home, they would do home health at home. Okay, so home health with all the nursing needs. As the therapy provider with home health, we make sure that the patients are safe and independent,
Okay.
moving around the house. Okay, so
So you actually take them through their house and kind of say safety, not safe, kind of help with them with that.
we teach them compensatory techniques. Also part of our goal is to modify the home, get rid of clutters, fall hazards, and stuff like that. So we do that as part of the treatment and goals.
How receptive are they to you saying that's clutter? You need to get rid of that. I'm just asking for a friend.
You want an honest answer?
I do want an honest answer.
50%.
Okay.
50%.
I can see
I mean, most of the time, it's the patient who had a fall and had a fracture are the most receptive.
Yeah.
But the patient who fell and just had a bruise or something like that, most of the time they would say yes. But when you go back there
It's
for the
still
next,
the same.
it's still the same. It's hard to ask them to remove a certain rug, hard to ask them to remove this furniture to this part of the house. But yeah, 50% of them does it.
Yeah, that's fair.
Pets too, that's the most
Oh,
problem that we have, because pets are fall hazard.
oh yeah, they are.
And if we try to ask them to, I mean, for now, temporarily get rid of them or move them
You get
somewhere,
better. Yeah,
but it's hard,
that's their babies.
Yeah, exactly.
Well, I totally get that. I'm getting to that age bracket. Don't know. I want somebody to come in and tell me I got to remove all this.
I'd rather have my pet than have therapy.
Yeah, right. I'm gonna just will it. I don't care. So, I've worked in long-term care, which is a skilled facility. Sometimes when they come out of the hospital, I've often wondered, and I've talked to case managers and things like that, why do you send them straight to Encompass Rehab or St. Mike's Rehab? Because that's more intense therapy if they're not ready for it. What makes that divide? How do they make that decision to do that?
Well, here's the thing. Most of the patients, I don't know how, I think it has something to do with the healthcare system that we have,
Yeah.
that they have to go through this process, these stages before they can do that. But yeah, you're right. I mean, you go to the patient's home and it's hard for them to tolerate this number of minutes for therapy.
Yeah.
And then they go to inpatient rehab
And
where
they are
have to
mandated.
do
They have to do.
30.
I think a lot of it too is they don't want to go to the nursing home.
Well,
as
that
soon
is
as they hear it's a nursing home, they don't want to go to the nursing home. Like they're willing to go to rehab, but we're not
willing to
the
go. And
nursing
that's why I've always, especially when I worked in one, I said, you've got to segregate it. You can't,
Yeah.
this is your rehab. This is your, not a nursing home, but your rehab part. Because I agree with them. I don't know that I want to go to a nursing home either. But if I'm there for rehab and understand it's short term, But I'll give you an example. I actually got a patient out of in-campus rehab. They went home. She made it one day, and I ended up sending her to a sniff. And she just recently discharged, and you'll be probably seeing her pretty soon. And her house is, she's gonna have to make some adjustments because we barely got her in the house last night. Gonna have to make some adjustments.
Yeah, the thing is, really, if the patient is motivated to get better,
Yeah, that's
inpatient rehab is the best place. Really, I mean, if they're willing to work,
put the work in.
3 hours a day, then yeah, that would be the best place. And I'm sure once they finish that, they might not even need therapy at home.
Yeah,
But
and I've seen that.
unfortunately, most of them really cannot tolerate that.
I don't think I could
number.
tolerate it. We already talked about my trip to the gym. It didn't go well. It's not fun, so I can imagine that's not
No.
fun.
And tell them, and you know, as we get older, we're not very motivated when people are telling us we got to do something. It's real hard. I'm like, why? But why can't I just sit here and watch TV? But you're not going to get better if you don't do the work. So I understand that. So how do you decide when you go into a home and you're doing home health, the routine or how often you're going to see them? Is it based on
It's
where they're
case to
at?
case basis. Let me give you an example. Ortho patient. It is very important that we have to be aggressive with therapy once they get home. Most of the time, then when they get home, most restrictions are discharged. For example, non-weight bearing and stuff like that. So you can be really aggressive with therapy. So I would usually recommend. I mean, in school we learned. I mean, even studies have shown that the optimum number of visits the patient can have to get result is at least 3 times a week. I mean, and I believe in that, and I've seen it. So that's what we do, especially with, like I said, orthopedic cases. We don't want. I always explain it to them that hey, we want you to heal. It's healing inside. Scars will form, and we want you to heal with that scar being flexible, so you will have the range of motion.
Because we all know after a certain age, nothing moves as quick as it used to, and it doesn't get any better.
Exactly.
So, okay. So with that, is that just 3 days a week for physical therapy, or is that mixed with OT, or is it just one discipline?
That's just, I'm speaking about physical therapy.
Okay.
Yes.
Okay.
For OT, I think with home health, it's, I don't know, but it's more on, like I said, home reintegration. So it's about getting in the shower, getting dressed, cooking, those stuff. But physical therapy is really more on functional transfers, walking.
Get your body back to where it needs to be so you can live alone or continue living by yourself. I get that. So you're not originally from Texarkana.
I'm originally from the Philippines, but from the Philippines straight to Texarkana.
Are you serious?
Why Texarkana?
Of all the towns in the world?
Every person I told that
Where'd you
story.
go? That one.
Why
Yeah.
Texarkana? Well, actually,
Please explain.
there's a lot of agencies from here who hire therapists from the Philippines.
Okay.
And when they asked me which state I want to go, I told them Texas because I have some friends and families.
Okay.
What is the best place?
Yeah. And it took them a while to find a placement for me. I mean, I had my license and everything ready for like almost a year. And then they told me, do you want to go to Texarkana, Arkansas? So when I checked the map, it's just the border. So I said, let's go.
You
And
could
I've been
step
waiting
across.
for a while. So that's how I started. I worked in a nursing home on the Arkansas side. And that's how it started.
And you've been here in
10 years.
10 years.
Yes, ma'am.
Okay. Well,
And I like it. I mean,
So was Richmond Road what it is now when you originally came? I'm trying to remember when it
yes.
changed. So Target was there, right?
Target was there.
Okay.
And I could remember when I was on the Arkansas side, it's like going to the city when I go to Target.
moving on up in the world.
Yeah.
Well, I remember when that was a horse pasture.
That's why I was
Really?
asking because
All of
I
that.
don't live in Texarkana. I live in Maud, which is like outside of Texarkana. And growing up, Texas side was the nice side, Arkansas was the not so nice side, like from an outsider coming. But there was nothing on Richmond Road back then.
It was a
Target
two-lane
was on
road.
the other side. And that was all a pasture. The movies were over there, but they moved at one point.
They used to be out at Nash.
Yeah.
Yeah. I'm going to say early 2000 maybe.
My first job in Texarkana was at Poncho's.
Oh, yeah, yeah.
And I only remember Richmond Road so well because that was the only road I
To get to
drove
it.
to get here back then. But there was nothing over there really.
I can't remember the name of the owner that had that ranch or farm.
But it was just a big old cow pasture.
Oh, yeah. Cows, horses, they had it all.
Since I got here, the only thing new in Richmond Road is that bank there, the Diamond Bank.
Oh, there's
Oh,
banks everywhere.
there's a bank
and
on
car
every
washes,
corner.
don't forget that.
The car wash, yes.
They
Those are
started
the
adding
new
those
things.
in.
Yeah.
Yeah.
But Target was already here. It was already there when I got here. Everything.
It has grown a lot.
I
Certainly
heard,
has.
yes.
It has over the years.
And Richmond Road has been so busy.
Oh, yes,
Most
it is.
people don't want to go to Richmond Road.
No,
I've noticed that.
No. no. I try to avoid it, but it's kind of hard with where
It
we're
doesn't
at.
bother me. But my husband and I have these arguments all the time about how to get where the quickest, and if we're not in the same vehicle. Like I always beat him, but every single time he thinks he knows the
He's
right
got
way
the shortcut.
because he's like avoiding lights. That's his way to go through things. I'm like, I'm in this town all day long, every day, running through here. Trust me, one day you'll.
I've got this. I got this.
Mhm.
I know how this works. So, get a little personal. Raffy, are you married?
Yes, ma'am.
Okay, there you go. You have children?
Yes.
How many children do you have?
I have 3 children.
Aw.
All girls.
Oh,
Oh, bless
bless
you.
your heart.
We
What are
talked
their
about
ages?
this last week too. I have all boys. I have 4 boys. So,
Oh.
I just have one
and
girl.
I'm.
Now bless your heart.
No,
no, the girls are.
I'm all
'Cause,
about the boys.
I don't know how long have you been with this industry. You.
A long time.
I have noticed that, I don't know if you agree with me, but the daughters, they are hands-on taking care of their parents.
That is always going
Clean
to be.
them up,
Yeah.
feed them.
Yeah.
But the boys, they will be there, but they would be
They're
like,
standoffish.
what do you need?
Yeah.
What do you
I can
need?
get you financial.
Well, that's why I have made sure that all of them have gotten good, sound, jobs, and we're working out income things, future planning, plan for mom in there too.
You
So
have
that's
to have a
covered.
good relationship with the future in-laws.
They are,
She just has one daughter-in-law right now.
yeah,
Okay.
one right now, and I think she loves me. I think
That's
she
good.
does. So we're good on that.
She's not going to send you to a nursing home?
Oh no, that's clear. That's clear. I've already told them. I don't care if you pass me along, like I can
This
spend
week
a
you're
week
here,
with
this
all
week
of
you're
you.
there,
I
yeah.
don't care. That's fine with me. But no, we're not, because I'm a nurse. I've been in. No.
It is different with male and female because I'm one of 6, and I brought my parents into my home and took care of them. My brother goes, I'll bring anything you need, but I can't do
Yeah.
it. I don't can't do
Well,
it.
I also space them out nicely, so nobody's gonna get tired of taking care of me. It'll be okay.
You spread out with love.
Yeah.
So what are the ages of your daughters?
I have a 23-year-old,
Oh Lord,
a 16, and a 9-year-old.
you do not look like you have a 23-year-old.
Thank
You've aged
you,
well.
Thank you.
Yeah.
My 23-year-old, she's a physical therapist as well, and she's coming over soon.
I was gonna say, does she work with you? She
She will eventually, but she's in the Philippines right now.
will. Okay.
She's working on her visa because
Okay.
she went to school there, so for
Alright.
physical therapy. Yes.
How long is it to go to school in Philippines for your physical therapy?
The master's is 5 years.
Yeah.
That's what I got. I had my master's there for 5 years. When I got here, I took my doctorate for another 2 years.
Mhm.
But it's a hybrid program.
Well, and there's not, as far as like for somebody to go for a PTA here locally, there's what, a school in Mount Pleasant?
A school in Mount Pleasant and Cossatot in
Okay.
Yeah.
Ashdown.
Yeah.
Because I have one now that's in the electrician program here in Texarkana. But originally, I was trying to push for him to go in to be a PTA, and he spent some time with me in a long-term care and realized quickly that
That's
that
not
was
his-
not going to
his
be
cup
his
of tea.
cup of
Ask
tea.
him to go to an outpatient clinic,
Yeah.
then he would really like it.
Yeah,
I try to get my daughter. She's a nurse here. She actually works for a retreat. I wanted her to become a physical therapist.
yeah.
I said because you know what, it's just a different realm
It is.
versus
Mhm.
nursing.
I started out in respiratory therapy and realized after 2 semesters, this is
Didn't want to mess with all.
no, like of all the things, mucus is not
Not your friend.
It's not my friend.
You'd rather
so-
deal with the other
Yeah,
ends.
then I rolled over into the nursing
Nursing.
side of it and stuck there for a while. But I have an accounting degree too. Like it's one of those things that said I'll probably always be figuring out,
What's going on in
yeah,
life?
what's happening next. Because you never know. But it is extremely neat to see somebody go through therapy and come out a success. 2 years ago, my son was playing football at a football game, and had a spiral break, I think.
Mm.
And then tore his tendon and ligament in his leg. So we had plates and screws, and then we had two tight ropes on the top of his foot. He was also a baseball player and a pitcher, and that happened in October, the very beginning of October, and he had surgery, had all of it fixed. We were in a cast, then we were in a soft boot. We were non-weight bearing for a really long time on a scooter, and then he woke up every morning before school and went to outpatient therapy and got to start his baseball season like nothing had ever happened. He was a little slower, and we did have to do a lot of ice after every game, but that was his biggest worry, because football was like the thing that carried him to what he was passionate about. And if he had not had a therapy group that was willing to get him in and work around his schedule, he wouldn't have been ready.
But he was willing to do the work to get there.
It was his junior year, and he was like really wanting to be out there on the field. And I said, well, it's just going to depend. But he was way more dedicated than I would have been.
So bringing that up, how do you get past someone that is just not motivated? How do you get them to be motivated? Or is that something you're just like, oh Lord?
Do you get mean?
we like I said, I mean, we can only do so much.
Correct.
A part of the when we set goals, when outcome measures, we also consider the patient's motivation, history,
Non-compliant.
Yeah, so we base our goals on that too.
Good day, bad day.
Although we can't stop trying to motivate them, convince them, talk to them, but like I said, we can only do so much.
We live that world. We know. I
Yeah,
mean, you can go in there and they say they're motivated, but then it doesn't always happen that way.
Exactly. Some of them, when they start feeling the pain of therapy,
Done.
Some of them, when they get frustrated not being able to do things that's asked for them to do in therapy. I mean, it's training. We don't expect you to be able to do this. It's a step-by-step process. So they get the what do you call this? They lose the motivation. They get frustrated.
Well, they get depressed.
Yes.
So if you're seeing somebody and you see that they're like, they were gun-ho at first, but then that motivation starting to go down and depression start to set in, is that when you start communicating with the nurse saying, hey, something?
On the home health side of it, we communicate with the nurse. We communicate with the family members if they have any. Yes, definitely.
Because I have recently, it's been a few months now, and I think, Deb, you were with me that day. The hospital called for a home health person, and we get up to the room for me to do the consult, and the poor lady had so much pain medicine that I couldn't even keep her awake to talk to me, and she was really gonna need therapy when she got home. And I just kept wondering, how are we gonna get through this with her, having to have her pain managed and get up and get through therapy. And I think she ended up okay, but how do y'all balance that? How do you balance when the pain is so bad? Like, I've always heard knees are the most painful surgery. Like, knee replacement is one of the most painful things, but that's also the one that they get people up the quickest, isn't it?
Yes.
Besides a C-section, my God, they rolling you through there.
Yeah, actually, the knee, you could say, yes, it is painful, but I have seen some patients, you'd be surprised. I go to their house. Normally with knee, they do the surgery today, they go home tomorrow.
Yeah.
Okay. So, I mean, there were times that when I knock on the door, somebody would open the door and I look for the patient and don't realize that's the patient walking without a cane, without a walker.
That's good.
But I have seen also some patients who, up to the point of discharge, they're still using a walker. It is difficult to, because the knee range of motion is very important with therapy.
And their ability to have whatever their pain tolerance is. Some people's pain tolerance is a lot higher than others.
Exactly. And to be honest with you, I've seen older population who underwent knee surgery has a better pain tolerance than the younger ones.
Oh, really?
Oh yeah, it was difficult to rehabilitate 50s patient with knee replacement, in my experience. Because of, I think, I've asked some of the patients. I've asked some patients of this because probably those patients had the pain for several years, but the older ones have those pain for like 20 years and they've developed the tolerance already. So And most of the thing that the usual problem I encounter with knee patients is once they start walking, they're okay with it, and they do not realize that if they are have a limited range of motion in the knee, they will see some problems later on when they start getting in and out of the car, stepping up and down steps when they cannot bend the knee.
Well, I'm noticing in my knees when I'm going upstairs, it's starting to hurt. I'm like, holy, what can I do to
Cut it off.
cut my leg off? Oh, well,
That's
you know,
the easiest.
besides that, is
Besides
there any
that.
other options?
Normally, yes, we age, we develop arthritis, and we know arthritis is progressive. I always explain this to patients. With therapy, we'll try to do our best to eliminate the pain, but in some cases, like this is a progressive disorder, we may not be able to eliminate that totally. We can decrease it a little bit, but we can slow down the progression.
Just quit going upstairs.
So
Yeah.
we
My
can have a
philosophy.
whole let Raffy diagnosis with help situation. What was that? Was it in February I couldn't walk?
Oh Lord, she was falling apart. When was your birthday? December.
December.
Let's go back to December. Prior to her
She's trying to
birthday,
throw my age out there, but
prior to her
had-
turning a certain number, everything on her was falling apart. I said, "Girl, you just getting to the tip of the iceberg. Wait till you get to
I
50."
had one of those decade birthdays that's not.
She didn't want to talk about
No.
it.
Mm.
But like I think I got sick after that.
You did.
But I woke up one morning and was trying to get dressed, and I could not pick my legs up.
Well, she would
But
stand
then-
up, and I'm like, "Are you gonna make it?"
By the end of the day, I couldn't hardly move. Like had I I was okay if I was up and moving.
Mhm.
If I sat down and went to get back up, you could hang it up. Well, then by like the third day of this, I have a ginormous knot in my back. Like I'm not imagining it. Like my husband has felt it. I made everybody in the office feel it because I'm like something's not right. So then I saw Andrea and she was like, I think it's your sciatic. She was like, I'm gonna give you some steroids and we'll see, how this works out. It got better by like 2 or 3 days, but I had to come off the steroids because nobody at the office wanted to
It's a
be
miracle
around
drug.
me.
Well, it's a miracle
But-
drug, but it has a side effect to some people.
So I didn't
A
finish
lot.
them because I would have been alone in the world had I finished it. But it does not go away. Like whatever, if it really is like your sciatic. So I know that's common because even Riley that day was like, oh, I had that too. I have to like, whether it's hot or cold, I always have my seat warmer on in my car because that does
Makes
help
it feel better.
Like my oldest who's married and doesn't live there anymore, he'll watch me get off the couch and because he doesn't see mom as frequently anymore, they laugh because like your process of getting off the couch
It's
now,
not like it used to be.
no,
Mhm.
like you have to work yourself back up to your full, and I'm already short, but I think I'll be the old lady that's looking at her feet.
Well, wait till you start adding sounds to getting up and walking. It
But I
really
have
gets better.
Googled like I don't think my sleep position's not good. And if I am like on a couch or anything that does not have arms, I sit on my legs. And,
Oh, behind you, underneath you?
Uh-huh.
Oh, no.
And then if I'm sitting in a chair with arms, my legs are always crossed. So does that make it worse?
Well,
Or how do you fix sciatic?
Cut it off. Cut it off.
I'm not, to be honest, I'm not even sure if it's sciatica, we call it
Yeah.
sciatica. First thing I would really recommend is an x-ray.
Yeah.
Get you an x-ray and then a thorough evaluation because there's a lot of patients complaining of back pain,
Mm-hmm.
different symptoms, and there's a lot of possible causes of back
Back
pain,
pain.
and radiculopathy, weakness. Could be the spine, could be the SI joint, could
Yeah.
be, you know,
Raffy,
the
stop.
hip joint.
Raffy,
Well,
stop.
no,
You're going to
because
have it
I
going down a
did-
dark
well,
tunnel.
I saw, I had my youngest is 3,
Mhm.
and I was 36 when I had him for about 2 weeks, and then I turned 37. All of my other children I had in my 20s when I was
Mhm.
young. So your bounce back is very
Yeah.
different in your
Yeah.
20s than it is
Mhm.
when they call you a geriatric person. And I realized then, after I had him, that things were not like they used
Can I
to
go back
be.
where they
Of
used
course.
to
Because
be?
when you would get up in the morning, it was much harder. But I was like, well, it's because I'm not sleeping good. I saw a chiropractor, and she sent me for an X-ray, and then was like, I'm not really gonna pop on you much more anymore. And that part of my back never hurt anymore. But it may be something other than sciatic because when you lay flat, it's worse. Like
Oh,
that's my problem. I can't after I've laid flat. like when I would go get my lash extension, she'd have to help me up. I had to roll off because getting from laying flat to sitting up, it was very
Not your
painful.
friend.
Do you have any numbness tingling? That
I don't
goes down
have.
the legs?
That's
Yeah,
the
'cause
only
that's-
thing that.
Normally, that's the hallmark of sciatica. 'Cause
Yeah, I have
You're
none.
impinging the sciatic nerve on this level.
Y'all make my
here.
back hurt
So,
They gave me a bunch of exercises to do.
to do
to
stretching
help,
and all
yeah.
that.
mhm. Well, I mean, that's the thing. I mean, they could give you exercises, this and that, but you really have to point out what's the source, what's causing the pain. I have seen a lot of low back pain patients that would come to me. Upon evaluation, we would realize it's the SI joint that's the problem. Because
What is
the
that?
symptom of the SI joint, same as sciatica, same as low back pain. It will have the radiating pain, pain on the back, referred to the hip. You know, they would come to me, I have hip pain. This
Well, I have
and that.
hip pain too.
Oh, so what is this nerve?
A
What is
sciatic nerve is when when the lumbar, the spinal nerves join together, form that sciatic nerve that passes down here and innervates the leg. Okay, that sciatic nerve passes underneath the piriformis muscle, which that piriformis muscle, in most cases of sciatica, they get so tight and compresses on that nerve.
So it's really
making
not
it
that one, it's
irritated.
that one. Wow.
So what we do in those cases, we treat that piriformis muscle. We make sure it relaxes. We do stretching, proper positioning. So
I did try the exercises.
mhm,
And when I went to the chiropractor, the little tens thing that she did,
mhm.
I was like, I just need that. Like, I'm okay with not being popped if you just do this every time I come. Because that's
The-
magical.
The thing with TENS is, it's just good when it's there.
Yeah.
You take it off.
It's
gone.
instant gratification that it
Yes,
doesn't
like
last.
it's exactly that. I'm not one of those people, like I've never had a massage.
Oh, God, I have.
It creeps me out.
Oh, no.
I don't know, it just creeps me out. Like, well, I'm not a touchy-feely person anyway, so.
Well, I'm not either, but a massage all
yeah,
day long. We went
I'm-
on a cruise and I literally, every day I was in getting a massage.
Oh yeah, that's really good. I like massage.
Oh, my
It
God.
I
relaxes
signed
me.
up one time when I was in Cozumel, and it was my turn. And I was like, pass. I'm gonna pass on this.
If you ever do it, oh,
It's good.
it is wonderful.
Relaxing.
The best.
It's very
Well, I bet
relaxing.
that's probably like the effect that I got from the tens thing.
It probably is, because I'm going to tell you, if you ever have one, you don't want to
Yeah.
stop.
I usually fall asleep when I get
Oh,
massage.
I'm worthless the rest of
And
the
I
day.
hope they can do it for like hours.
I know, I'm like, you're done? Are you
No,
sure?
yes.
I think I still have some pain here. Here.
No, the closest I get is when I go get my pedicure.
Yeah.
Oh,
So I would
legs.
advise you to get checked, because the thing with back pain is it's on and off and on and off. When
You
they
feel
come
better?
back, it's worse if you
Yeah.
don't do the proper treatment. And at this point, I think while it's still manageable,
Yeah.
let's do that. Do therapy, exercises. Like I said, it might not fix it totally, but at least you
Yeah.
have a longer time to enjoy your back before you
Yeah.
undergo injections, you undergo surgery.
You're not even
Yeah.
close to 50 yet.
No, and I'm
Look-
gonna be in
look
my
out.
50s with a high schooler.
I mean,
Yeah.
our generation, I mean, I'm older than you, but we have developed a lot of bad habits, poor posture,
Oh, I have
especially
terrible-
the younger generations. I mean, after us, like very common now. I don't know if you've heard of it. It's a text neck.
Oh, yeah.
Actually, it's like this.
Oh.
So I
I
mean,
think I was born with that. I only say that because I have
A
you see
curvature?
that? I
A
have
curvature?
not. I always wondered. Nobody in my else in my family has
and
it.
that would be when you start feeling neck pain, you'll start numbness,
Yeah.
tingling here, and that's.
No, I
because of
have
that.
carpal tunnel. Very weirdly.
Mm.
I've never I've worked in an office for a little while, but I've always been a nurse or like
In
what I'm
sales.
doing now.
Mhm.
So I've never been somebody that has sit and been on like a keyboard or anything that would cause you to have carpal tunnel. But
Sometimes carpal tunnel is caused by some hormonal changes.
I have had.
Common in pregnancy.
They've had to do. Well, that's when mine started,
Mhm,
and it never went away. And it's worse in my left hand,
mhm.
and that's not my dominant hand.
Mm.
But I've done steroid shots and all kinds. I don't recommend that to anybody. It was not fun.
The issue with steroid shot is yes, it's a miracle drug. It
Mm.
fix it, but
I had 2
I'm
days
not
or 3
totally
days.
against it. But if you have other conservative, even your doctors would know.
Yeah.
If you have other conservative treatments, because normally steroids on the joint, studies have shown that after prolonged use of that, the soft tissues, we call it soft tissues there, they become brittle.
Mm-hmm.
Mm.
And so the next stage would be replacement. But I mean, if it could help, then yeah, why not?
So
That's why I'm saying before it gets worse,
Yeah.
do your therapy,
don't
learn
know
the
me that well,
exercises,
Raffy.
and keep.
I'm a procrastinator.
Oh, Lord. I'm over here going.
It will be like an emergency of that
She
day
has
when
to
I
be in
had
dire
to
pain.
text everybody and tell everybody, I'm so sorry, but I'm going to be late today
Yeah.
because I can't get my
Yeah.
pants on. Okay, because you've been in the Philippines and now you're in Texas.
Mhm.
Or are you in Texas or in Arkansas? Did you finally get
Texas,
to migrate
I'm in
into
Texas,
Texas?
yes.
Okay. So I know the lifestyle in the Philippines is much different than what it is here.
Mhm.
Diet is also very different, right?
Mhm. Oh yeah.
I have a friend who has a significant other that just came here from the Philippines, and I haven't got to meet and talk with her yet. But just like my husband has told me, she's having a hard time adjusting with the diet and the climate, because it's already warm to us, but she's kind of feeling like it's been cold a few days. But the diet is the hardest part for her. So it's mostly like seafood, right? And
No.
lean things or
No, actually, rice.
rice.
We
Okay.
eat rice 3 times a day: breakfast,
I could do
lunch, and
that.
dinner.
Well,
I love
I
rice.
probably could. I'm back and forth on rice.
So
But
how do you make a breakfast out of rice?
Just plain rice and a viand.
look,
Like,
what?
let's
have you never
say
had you come to Texas?
something meat. You know, you
But
have
it's
to eat it
dinner.
with
But
rice.
that's dinner.
Instead of bread,
It's-
we use rice.
Yeah.
Yes.
So
And
we
see, I
with
would do
rice we still
better.
have the bread.
So my great grandma used to make us rice because all the grandkids would be there in the summer, and she would put butter and sugar.
Yeah.
And
That's,
cinnamon in
that's
it.
rice pudding.
And then, my husband is Hispanic, and they, Hispanics have the same,
They eat rice.
kind
too.
of like that too. Yeah, they eat rice and beans with everything.
Well, I'm from
But-
South Louisiana and we eat rice with
Yeah.
everything. So.
But you have to eat rice with
it's-
something. You
yes.
cannot eat rice alone back
Oh no,
home.
my mother would eat rice
Yeah.
by itself.
Really?
She liked it.
Eat it
With
with
a little salt and pepper on it.
fish, vegetable, meat.
Or
you
cut
know.
it, slice up tomatoes and put it on her rice.
How would you compare the health and what you
Oh,
see
Lord.
there versus here? And do you think like the diet
I don't
plays
know.
part
I
of
mean,
it?
that's been a question. It's more on the genetic side, I believe.
You have
Yes.
good genetics and we don't.
No, it's not that.
Well, no,
It's.
I'm wondering how old he is now.
I think if it's.
We're just going to ask, how old are you?
Let's not talk about age.
You're not a female. We can ask you.
Yeah.
Females are the ones that get real.
Not anymore.
Males are a little bit sensitive too.
I'm in my 40s.
Okay, well,
Okay.
Okay.
that's what I figured.
Well, I feel like I look a whole lot older than him.
No, it's genetic. I mean, the thing is, like I said, we eat rice 3 times a day.
I'm gonna
If
start
you
eating
count
rice
the
3 days.
calories there, but
And it
now,
fills you out, just
but here the diet's more bread.
carb.
Bread.
Mhm.
Now, if you think
Pastas.
about it, it should be less on the calories versus rice, right?
Mhm.
But the way we make our bread, I've sat on a roundtable discussion with most of the doctors in town. We have that once a month, and I get to be invited. And one of the diabetic doctor, I think, was talking about that. It's the glycemic index on our bread right now, and he was saying, "Did you know how they called our bread during the old times? Cake." So
Mhm.
that's how it is. We're eating cake. We're eating a lot of sugar.
Oh, my mother was addicted to bread, but she wanted her bread with her rice and everything else.
Mhm.
She was
So,
a bad
well,
diabetic.
and that's the problem. Like, my husband will get bread with his starch, and that's different. I'm more of a meat person anyway,
Me
But
too.
I can do rice. I can do rice with meat in it, but I'm
Mhm.
not just like a rice person.
Mhm.
I can make some really good rice. It may not be all that healthy.
Now, see, I love grits.
Mm.
And I eat grits for breakfast
Mhm.
because that's my breakfast.
Mhm.
And I just put butter.
But what is a
and rice.
grit? What is that? Is that a potato or is that a grain?
Mhm.
Yeah, most of the time we cook rice, steamed rice, just plain rice.
Mhm.
So it's carb, but it's more of the natural side.
So what does the serving size look like? Is it like half a cup, or is like your plate
depends, it
full
depends.
of it?
Like a cup of rice, usually
It kind
one
of swells
meal.
up
Yeah.
when it's done. Anyway.
Yeah, 1 cup, and then you have fish or a vegetable and meat, something like that.
Yeah.
Yeah.
Not fried meat, just kind of.
And I think, to be honest with you, it's the portion. I don't know, probably.
Texas is everything's bigger, so that's why.
Exactly. You eat like a Whopper back home versus a Whopper here. I think the Whopper here is bigger
Oh, it's
because
not
I
that
love
big.
Whopper.
Yeah,
I
it's
like
not that big.
yeah. So yeah, in the sweets,
Oh.
I've noticed. I think that's one thing. We are not much of a soft drink, a sweet tea drinker back home. It's more water. But here, I've noticed that kids are like uh, a lot of soft drinks, a lot of sweet teas.
I was raised on
It's all
water
about
or
sugar.
sweet tea, and like my husband, his whole family is like carbonated drinks, so
Sodas,
Cokes,
yeah.
Dr Peppers, things like
Mm.
that. So when we like moved in together,
Mm.
I was not a big Coke person or
Mm.
Dr Pepper or anything like that. That was only if it was like you had an event or something, like
Get
you know,
splurge
you were
and
going
have it.
out for the
Special
day,
occasions,
yeah.
yeah.
Because we just drank sweet tea, but I had to wean myself from that too.
Don't get me wrong, I love Coke. It's just that sometimes if you think about the sugar content of Coke,
Yeah,
it's
it's not
just
good. I know when I was raising my daughter, she didn't have a soda. She drank water, and we go to a restaurant. And I said, "You want a special drink?" She thought if you put lemon in your water, it was a special
Yeah.
drink. But she never craved it. I don't really think. We went to a movie with a group of her little friends, and they were getting Dr Peppers, and she's like, she didn't want to be at the one out. She goes, "I'll get one of those." I said, "You've never had one?" She goes, "I'm gonna do it." She took 2 sips of it. She goes, "Can I have water?" I'm like, and at the movies, I'm like, "No, you're gonna drink that drink."
Yeah.
That's $4. But she's still not. She'll drink it now, but it's not all the time. It's mainly water, flavored water, which I'm glad because I'm
I
horrible.
had to survive on water.
I would not make
Like
it.
I really survive on Diet Coke now.
Diet Dr Pepper and Diet Coke's my. I think that's the water I drink. It has ice in it. It's melting. That's water. That's my philosophy.
Yeah.
Now when I know I'm
They use the
dehydrated,
sugar.
when I know I'm dehydrated, I'll go get one of those packs you put in water that gives you instant hydration, and you do feel the
Those
difference.
are terrible though.
Yeah,
Tracy
they
gave me
taste
one.
like.
I felt bad one day, and she said, "I think you're dehydrated.
Yep.
Here, drink this." I said, "That is the worst thing I've
Ooh,
ever."
you just
tasted."
drink
If
it
you're
fast.
dehydrated, just go get a Pedialyte.
Well, yes,
Oh, you know what? You're right.
Yeah.
You're right.
and that's the other thing. They don't. It's more of sports drinks now.
Yes,
instead
which
of-
is
Mm.
higher calories
Yeah.
And Red
versus
Bulls
just the
and all that
regular
other stuff.
Pedialyte.
Ooh.
I had
If
a Red Bull.
The
This morning.
electrolyte content's the same. That's
Mhm.
what you need. You don't need
Yeah.
those calories.
So how many? We're going to switch. We can
Okay.
Yeah,
talk
I
about-
told you
look,
we're
we
all
can
over
talk-
the place.
We can talk about food all day long because we do love food. But so in your group, in your business, how many therapists do you have currently?
I have a team for outpatient,
Mhm.
and I have a team for home health. For home health, there are several because you know how it works with staffing. Most of them are PRN. You get some full time, meaning full time caseload. But with home health, I have 6, including the OT. But I've got one that's coming out from recovery, so she's gonna be she's gonna start seeing patients as well. But with outpatient, we have including me, there's 3 of us in the clinic.
So have you gone through that, which we all have gone through, keeping people and people wanting to work, or has it been hard to find therapists or getting them to stay?
To be honest with you, in our area, it is hard because fresh graduates they would want to be in the city.
Yeah, Texarkana's not the city they're
It's like a
looking for.
retirement place, Texarkana. But yeah,
so
it's hard to find staff. I mean, I'm glad that we have like a PTA school here,
Mhm.
Not too
in
far
Mount
away.
Pleasant. Yeah, and I heard they will start a DPT and a Doctor of OT program at Texas A&M.
Oh yeah, they
That
did
too.
talk about that.
2026.
Yeah, they talked
So
about it at one of our meetings.
that would be good for us. At least we'll have enough.
Well, it's very
Staff here.
competitive. I know Mount Pleasant is very competitive with their program.
Even Cossatot. I
Yeah.
mean, my PTA came from Cossatot, 2 of them. So I think it's like they usually start 24 and then graduate.
Wing it out,
10
yeah.
will graduate.
Same thing with nursing. But I know when PDGM came in place, that really made a lot of therapists nervous because it was, it was going to affect some of the.
A lot of things changed.
Oh, yeah.
PDPM first in the nursing home, and then PDGM with the home health. So that's a lot of changes, and it always therapy always gets a hard hit on those things.
Yes, they do. They did on that one. Nursing.
And it'd be realized. I mean, shifting from home health to outpatient, outpatient physical therapy, I could say. I mean, all of us therapists will agree with this, that we are the bottom dweller on the physical therapy practice setting.
Mm-hmm.
We have the least reimbursement. And if you think about it, every year we have a reduction. And it has shown, I was reading a study last week, since 2003 up to now, the total reduction, including inflation computation, therapy reimbursement is 23% less.
Wow.
And imagine, what do you call this? Minimum wage, it has increased. Everything went up, but our reimbursement stays the same.
And that's
I mean,
just
it's
the case
lesser.
across healthcare,
Healthcare.
across the board.
Mhm.
Medicaid has put out some new things last week that is going to be very hard for healthcare agencies to stick with and follow, and they have given them, I think, 2 years to get all systems in place, but they're now telling people how they can spend their reimbursement.
Instead of giving them a lump sum, and they do.
Oh, no, they
do
get the lump sum,
But then they're going to manage it.
Well, so when you turn your reports back in, like in home health, Medicaid patients, 80% of funding has to go to staffing. So it gives you 20% for cost, like
Supplies and different things.
overhead, things like that. So they're not just paying people anymore and saying,
You do
here, you did the work, here it is. And then like long-term care, that was in the same set
Yeah,
with
there's a bunch
that.
of changes coming for them.
Their RN time has to be increased.
Round the clock.
I think 3 hours minimum in some settings, and then some it is around the clock. So it's regulated everywhere. I will say, I was always long-term care and hospice before I came to retreat. And in long-term care, I did like MDSs, so I understood like
The cost part.
the cost part with therapy. And I worked in the OR, and it was never a thing. Like I came in and did my part, and then I never saw a person after that. I didn't really get into therapy much until I came to retreat and had home health. And I am now. But when I first came, I did not understand home health other than, for somebody who had just had surgery, or maybe a new diagnosis. I had not gotten on board with it. And I think it's probably the same thing like what you go through that we see with all of the programs that we offer, trying to get somebody to understand what the benefit is until they need it is harder. So they just don't listen until it's in front of them. But knowing like how many things now that you could actually prevent if you started therapy sooner rather than the reaction, like how I operate,
That's what we always explain to the patient. Like, hey, you might think that you can walk now, but I mean, with your condition, medical condition, and everything, I could say you'd probably be in a wheelchair in 6 months. But if you do therapy right now, you would be in a wheelchair for like 2 more years before you get to the wheelchair, So, I mean, that's one thing that I try to explain it to them. We want to keep you at the highest functional level you can be. Because eventually you're going to get there. If you don't do therapy, that will come sooner.
Yeah, you got
sooner than later. Well, and I think, we run into it each and every day. You don't think about it until you need it. And then it's a desperate situation. I mean,
Right,
especially
like in your case.
Yeah, it's going to become a desperate.
Yeah.
I'm not going to pick you up and put you and help you.
Somebody's going to have to help
Classic example.
Eric.
Wait for her to be bed bound before she would consider therapy.
It's not. That was rough. That was probably the roughest 2 weeks trying to get out of chairs and stuff. I said, everybody would be like, have a seat. I'm like, no, I'm good.
I'm going to stand here.
I'm just going to stand right here because
I
I don't
understand
know
your
if this is
feeling.
gonna
I
be
have the
right
same
time.
problem. I have a back pain on and off. The latest episode I had was last year, to a point where I had to go to to Healthcare Express, and they gave me a low dose steroid for the pain.
Yeah.
And since then, I really focus on my back health. So every day when I go to the gym, I would rather cut my workout short than cut my warm up, my back exercises short. So
Well, I'm only going to the gym to walk over to the tanning bed section. We've already figured out
she tells us
it's not fun.
Mhm.
There's nothing about it fun, so I don't.
Results. You got to look for the results eventually.
I think I could probably do like stretching exercises and like try to. I didn't bring my little
Think about it.
bowl in, is what I should have done.
Rachel, think about it this
Ooh.
way. You're gonna have grandkids. You want to play
Oh,
with
don't
them.
bring that up
That's
to
a
her.
very and
You
That's
want
a
to play with
sensitive-
them. You don't want. You don't.
Raffy,
Yeah.
she won't talk about it. She
Because
won't.
I was thinking that. I mean, when I get to have grandkids, I want to be
Yeah.
able to play, walk with them. You
Rachel,
know?
how do you feel about that?
Instead of me being in a wheelchair.
In due time. In due
Rachel, how
time.
many years are we talking?
At least 5. We've already
She
me and Jesus
You
have
thought,
talked
have
about that.
you thought about what do you want them to call you?
Oh no, it's
This is her
Grandma?
goal.
No,
she's
I
got
assure you, it
she's
will
got
not
to
be.
get her 3-year-old in school before anybody can have a baby.
Mm-hmm.
My oldest got married last year. Actually, Monday will be their 1-year anniversary. So I've asked them from the beginning, like, yes, I want you to have kids, but I want you to live your life, have fun, enjoy being, just a young couple, and do the things that you can do before you jump into parenthood. Because it's not fun after that. I mean, it is, but it's not as fun.
Traveling,
I also would like to get your little brother in kindergarten first before.
You throw that in there and they're in the same grade. Please don't do that to me.
That's why I always look at people's skin, because I said, I never really thought about it until Job was here. Somebody may think I'm his grandma.
She
and I
said
don't
the first
want-
time somebody comes up and asks her that, it will not be pretty.
You might as well put me in the wheelchair then.
She will not be having a good day.
You might as well put me in the wheelchair then. There's not. I'll have to retire.
Well, I would love to have grandchildren, but my daughter's not married and living her life. So
yeah.
and I'm gonna be 30 next month.
So, do you just have locations in Texarkana, or you have more than one?
We have
location
one
already?
in New Boston as well, which we opened a year ago.
Okay.
So it's still a work in progress.
And how many patients do you see in the New Boston area? You would say
It's on and off. It's like home
hit and
health.
miss.
Yeah.
Ups and downs.
We average 50 patients a week there last quarter of last year, and as usual, first quarter of the year. Talking about the deductibles, the patient don't want to do anything.
We run into that with home health too, and I always feel horrible because when they are in the hospital and then they send the referral and their deductible has not been met, but you know it's been met, but you still have to say, okay, well, you got to pay this out of pocket, and people don't want to do it.
No,
exactly.
Like, they don't, and I know, like, it was costly for Evan. He did all that therapy, and when I got the bill at the end of it, I was like, holy smoke. But he was still able to get up and do what he needed to do when he was ready. But my gosh, I said, you better, what did they teach you? So we'll figure that out here, because it was expensive. What his insurance didn't cover, but he wouldn't have been able to have done what he wanted to do.
But to be honest with you, in our outpatient clinic, I always tell this to my patients, or even the general population. You might think we're a private practitioner, but if you really look closely, we are employed by insurance companies.
Oh, yeah.
Because
100%.
they decide how much to pay us.
100%.
And I have to explain it to the patient. This is your copay, this is your co-insurance, but it's not us who decides this. It's your insurance who will tell us how much to collect from you.
So we run into every now and then people who want to private pay to have therapy continue and not stop. Do you offer that outpatient?
Yeah, we offer private pay. So yes.
Is that both ways? If they want a private pay in their home or private pay to go in, can you offer either, or is it just one or the other?
Yes, we can do. But
Okay.
I strongly encourage patients, if they can go out of the house, go to the
To get
clinic.
out, yeah.
We have better equipments, better facility,
Well,
and
you're
a
quick
reason
it.
for you
Yeah.
to, get ready, get dressed, go out,
Well, I always recommend, do home health at first, get to that
Exactly.
point. Once you get discharged from home health, do outpatient, because they're going to work on you even more with different things, so you don't lose that.
Yeah.
What does a typical therapy session look like if they come outpatient? Like, how long are they normally there? I know it would
Depends
be
on the
totally
need,
different,
but for me, it's usually 45 minutes to an hour of therapy session, intense therapy session. Because like I said, it's on the higher level. We're talking about community reintegration. We want you to be able to go back to sports, go back to work, be
So
able
you're
to
pushing their limits a little bit harder if they're
Yes,
outpatient.
I
than being
always use the term highest functional
Functions, yeah.
independence. Yes.
which is good.
Do you treat all ages, or
Yes,
you
we do
adult
all
only?
ages,
Okay.
but I'm leaning. I have some staff there, but for me, I'm leaning towards focusing on orthopedics and pain management and sports physical therapy,
There's
Yes, I
a need
have a
for it
little
in this
bit of
area.
background
Mhm.
on that one. Yes.
There's a
Yeah.
great need for it.
Hmm.
Well, I mean, we really appreciate you coming and visiting
Thank
with
you.
us. Is
Thank
there
you,
anything
thank
you
you.
want to tell about your practice, your
Well-
address, your
Like
telephone
if they
number?
want to,
Yeah.
how do they
Reach out to
reach
you.
out to you?
Mhm.
Like, do they have to have a referral from a physician, or can they just?
Pick up the phone,
With the
call you.
Texas law, we have what we call direct access. So, as a doctor of physical therapy, we can see patients without referral the first 10 days,
Okay.
and they can just go to our clinic or call 430-200-4222. That's Synergy Physical Therapy. And we'll schedule your evaluation after we've verified with the insurance. We do cash base as well. And yeah, give us a try. And I'm thankful for y'all. And I'm glad for this partnership with Retreat Home Health. And we'll do our best to get all your patients get back to where they were at or even better. So we improve their quality of life.
Yeah, that's
We'll appreciate
everybody's.
that.
Yes,
One
ma'am.
more reminder, we do have Mother's Day Bingo coming up next Friday, May 10th. It'll be at the Southwest Center from 9 to 11. We have a plethora of sponsors. So come on out, Southwest Center. I can't remember the address. 3222 West 7th. All mothers are invited. And a mother doesn't mean that you have to have a child. It just means that we all are mother caregivers. So come on out and enjoy that. And Raffy, we appreciate you coming today and sharing your information. And
What's the address? What's the address of your Texarkana location?
It's 3494 Summerhill Road, Texarkana, Texas. It's beside the Walmart neighborhood. It's the shopping complex beside Walmart
oh, I know
neighborhood.
exactly where you're at. Okay.
The most popular landmark there is the Chinese buffet, Golden Palace.
Yeah.
So
You're
most
across
of my
from the car
patients-
wash.
Yes, across the car.
Yeah.
Yes,
Yeah.
we are there.
Well, great. Well, we
Mhm.
appreciate it. I know we keep you busy with retreat patients.
Yes, please,
Yeah.
please. Well, to be honest with you, I always tell my staff it's me being their agent giving them visits. So I'm doing this for my assistants, my therapists.
Yeah.
Well, we
So,
appreciate
and
it.
in return, I mean, I promise, I talked to Ricky, I promise to do our best, really. We don't want to be the usual, there's a lot of home health therapists, but we want to go
Above and
or
beyond.
above and beyond to work with your patients, get them better.
Good. We appreciate that.
Yes,
Well,
ma'am.
this was Wellness Wednesday. It's May 1st. Woohoo!
You said Mother's Day Bingo. That's y'all's reminder to take care of your mothers.
Yes, because
That's next week.
May
That's
the
next
12th is Mother's Day. Mother's Day, May 12th.
May 12th. Okay.
And Rachel's already signed up with Crockers. Eric, just go ahead and get that list and be done with it and get that jewelry sent to her. She'll be a happy camper. Y'all have a great day. Thank you. for
Thank you. Bye-bye.
Choose excellence in healthcare. Choose Retreat Healthcare Services.